If a doctor was to strike, how would that make you feel?
Scared. My mum just got out of hospital, and I think if the doctors were going on strike and they weren't in the frame of mind or anything like that, it would worry me.
I think that those people wouldn't do it unless they had very strong reasons, and I'm completely convinced it's nothing to do with money or workload. It's fundamentally to do with people making decisions about ultimately what's in the best interest of patients.
So I'm not sure if you're aware, but recently it's come out that the British Medical Association have tabled another 3 days, or it's another 3 periods of strike action, each lasting 48 hours. How do you feel about that?
When I first think about how emergency services or people like you guys are going to take industrial action, like striking, I always feel somebody's going to suffer here. But then in the back of the mind I say, it's got to be done. You can't lie down and let people ride roughshod over the top. You've got to stand up for what you think's right. And the day that you don't stand up for what you think's right, that'll be a poor day for the NHS.
These are 48-hour walkouts now. How do you feel about that?
I think it's necessary because Jeremy Hunt's trying to inflict his will on against the majority, I would say.
The train drivers going on strike, the underground drivers going on strike, where they're trying to improve their pay and conditions is one thing. But where you're trying to defend the rights of the patients and what's happening to those patients should never ever get to strike situations, and the government should never ever have put you in that situation. Simple as.
At the moment they're covering emergency care, but if doctors were to walk out and not cover emergency care, how do you think that would affect public opinion?
I think quite badly, because I think they have a responsibility to maintain the care. I think they need to find a way to get their point across, and I think everyone sort of respects their views and thinks they do deserve more. But yeah, I think if they cut all the care, I don't think that's the right way to go about it. That will bring a negative view on it when actually all we want to do is support them.
Doctors also have a responsibility to provide care to those in crisis. That's their job. With the Hippocratic Oath, that is their point of their existence.
So you would advise strongly against emergency care walkout?
I think I would, yeah. I think that's too far, really.
I think I'd be inclined to agree.
Cover basic services.
Public opinion would expect you, having sort of gone through all your training and taken Hippocratic Oath, is it?
It's Declaration of Geneva, but it's based on that.
Same sort of principle.
Yeah.
They'd expect you to put that above and beyond. So I think that would be when you'd probably start losing a little bit of public sympathy. But you should never ever be put in the situation where you need to do that. Simple as.
I'm ex-fire brigade, and we had the same things. We stood on picket lines for our rights as well. But if there was a serious emergency came up, I feel sure somebody would go and deal with that emergency. Don't you?
I think you'd be hard pushed to find a doctor standing on a picket line not wanting to go for an emergency.